Hello everyone, welcome back to another session. A few months ago, we had a patient with colon cancer. A week after chemotherapy, he had a mild fever. He thought it was nothing serious. By next morning, his blood pressure dropped and he was rushed to the ICU. He had developed septic shock. Thankfully, he survived. Many others are not so lucky. So, what exactly is septic shock? It starts with an infection. Bacteria or fungi enter the body, sometimes through a wound, a catheter, or even from our own gut. Normally, the immune system fights back. But when the immune system is weak or when the bacteria is very powerful, things can get worse. The blood vessels become leaky, blood pressure falls, organs like the kidney, liver, and brain don't get enough blood. When the blood pressure stays low despite giving IV fluids, we call it septic shock. Septic shock can happen to anyone with a severe infection, but certain patients are at a much higher risk. Patients with cancer, with diabetes, those with liver or kidney disease, etc. Cancer patients are particularly prone due to a weak immune system. Chemotherapy reduces the white blood cells that fight infection. This is called neutropenia. When neutropenic patients get a fever, the condition is called febrile neutropenia. The bacteria can get inside through many ways. The gut or the lining of the mouth may get injured because of chemotherapy, allowing bacteria to enter the blood. Catheters and ports used for treatment can become infected. Steroids and cancer drugs also weaken the body's defenses. Because of all this, a small infection in a healthy person can become life-threatening in a cancer patient. So what are the warning signs? At first they may be vague: fever, chills, weakness, or confusion. The heart beats faster, breathing becomes quick, urine output drops, hands and feet may feel cold. In some patients with very low white cells, there may be no fever at all. So, any sudden feeling of unwellness during cancer treatment should be taken seriously. So, what should be done? Septic shock is a medical emergency. Every hour of delay in starting treatment increases the risk of death. Antibiotics are the most important form of treatment and they should be started as early as we can. Oxygen is usually given to keep the blood well oxygenated. Fluids are given through a vein to raise the blood pressure. Blood samples are usually sent for cultures. And if blood pressure remains low, medicines called vasopressors are used to tighten the blood vessels and improve the blood flow. All this treatment usually happens in a hospital or in an intensive care unit. Prevention is crucial. Patients and caregivers should report any fever, chills, or weakness immediately. Catheters and ports should be kept clean. Hand hygiene is vital for everyone handling the patient. All of us, and doctors in particular, have the responsibility to use antibiotics wisely and appropriately to prevent the emergence of resistant bacteria. Septic shock is scary, but it is often preventable. Early recognition and fast treatment can save lives. Thank you so much for your time. If you like the video, please share it with your family and friends. If you are new here, please check out my other videos and subscribe to the channel. We will meet again next week with another important topic. Until then, take care and stay healthy.